Senator Raphael Warnock touring Southside Medical Center in Atlanta, meeting with doctors and healthcare professionals and people with diabetes to highlight the rising cost of life-saving medicine. WSAV's Arsha Shashadri spoke with Warnock, getting answers about the proposed legislation that could save Georgians thousands of dollars on insulin.
New census data shows more than 1 million Georgians, or about 12%, are diabetic, with 70,000 people being diagnosed every year.
I think there's a reason why 20 states have capped the cost of insulin. This is not a partisan issue, it's a human issue. Not only is it the right thing to do, if you look at the math, it's the smart thing to do.
That's why Senator Raphael Warnock says lowering the cost of insulin will ultimately save taxpayer dollars.
It would cost us entirely too much money not to do this. We have an initial assessment from the Congressional Budget Office. To cap the cost of insulin for folks who have insurance would cost $629 million over 10 years. We can afford that. We cannot afford not to do it.
Senator Raphael Warnock says the Inflation Reduction Act has capped the cost of insulin at $35 a month for Georgia seniors. Now he has legislation that would expand that to all Georgians and Americans. Right now, on average, he says people spend around $500 per month on insulin. He wants to cap that at $35 for whether or not you have insurance.
We have to cover folks who have no insurance as well. There's a reason why Senator Kennedy of Louisiana has joined me in this effort. 15% of the people in Louisiana have diabetes, 12% of Georgians.
Senator Warnock says this new legislation would also minimize Big Pharma from making massive profits.
I think what you're seeing with the cost of insulin going down is the importance of having both good public policy and private sector engagement.
Arsha Shashadri, WSAV News 3 on your side.